When I first got the diagnosis for bladder cancer, my mind is just racing. I don't know what to focus on. I couldn't hear anything else that he said.
We had never even heard of cancer in that part of your body. I had never heard of bladder cancer.
I didn't know what would happen with treatments. I didn't know what the prognosis would be. I didn't know if this was a life or death situation. I didn't know where to turn.
My late husband, John Qualley, and I started Beacon in 2005, now 10 years ago. John was initially diagnosed with bladder cancer in 2000, the age of 53. And at that time, we'd never heard of the disease before, and we didn't know anybody else who'd ever had the disease. The scariest thing all along the way was not knowing what the next step was going to be, not knowing what our options would be, just the fear of the unknown.
Patients struggle with being able to easily get information and guidance about treatment options and innovative therapies, treatment opportunities that may not be known to their physicians.
There was no patient organization out there providing information with bladder cancer. And in 2005, we just decided it was time to do something about that. We talked to my husband's doctor, Mark Schoenberg, who was then at Johns Hopkins.
She came to me and said, "Will you help me meet the community of physicians who's engaged in caring for bladder cancer patients?" And I said, "Sure. In fact, we're going to have a meeting this year. You need to come to the meeting."
By the middle of May, we had a scientific advisory board of 18 of the leading bladder cancer specialists around the country. But I think the biggest challenge from Beacon from the beginning is just raising awareness about bladder cancer. Bladder cancer is one of the most common cancers with an uncommon lack of awareness about it. Our primary program in raising awareness is our National Walk for Bladder Cancer. And we ask volunteers all around the country to organize walks in their own communities to raise awareness about bladder cancer.
I really think back to one of the founders and to John Qualley's experience. I think what sustained him was information. You know, knowledge is power, to find out that you're not alone, that you're not experiencing this by yourself.
One of our primary tools, of course, is our website, which we started in 2005. It's a wonderful online resource with a lot of information about bladder cancer, about risks, about symptoms.
Information is very important for patients because patients have a lot of choices and have to be very engaged in their own care. There are a lot of forks in the road in caring for bladder cancer patients. The key to understanding what those opportunities are, whether they're relevant, what they might mean for someone long-term, is information. So being able to get at that information is the first step in being able to take care of yourself, being able to take charge of your healthcare.
I'm just so impressed with how they've pulled all the resources together and how much information you can get from the people, from the website, from the organization. It's just a great resource for people who need it.
The name of the organization, Bladder Cancer Advocacy Network. Early on in the organization, a lot of people pronounced it BCAN. And what Diane and others drilled into them constantly was, no, it's Beacon. It's a beacon out into the darkness of this disease.
Not only has Beacon provided a home for everybody who's concerned about this disease, but Beacon has a voice of its own. Beacon actually now counts in national discourse about this disease.
One of Beacon's primary missions is advancing bladder cancer research. There hasn't been a medical advancement in bladder cancer treatment for nearly 30 years, and that's simply unacceptable.
I think if we can build on what we've done over the last 10 years, so that another 10 years from now, there are established, well-funded, well-regarded, and well-known research enterprises regarding bladder cancer, and that maybe, who knows, in 10 years, one of those undertakings will have produced a treatment that works, then we will have succeeded.
I believe Beacon's had a great impact on the bladder cancer community because we've been able to give that community a voice.
What is important to me fundamentally, finally, about this organization, and what inspires me, is that it might save people. It might save lives. And that's what it's all about to me.
I'm hopeful that Beacon is helping others find that kind of support, find that community, find that voice so that you can live with your bladder cancer diagnosis, live fully, enjoy life, enjoy every day, and not dwell on the dark side, but really live each day to the fullest.